Well, first I want to say that I'm just very grateful to all my young colleagues who've entered the field of psychiatry. It's an amazing profession. It's a profession where you as a person make an immense difference in the lives of others. It's a very exciting field, and I think in this next 40 to 50 years it'll be transformed. The thing I like most about it is the fact that individuals, by virtue of their life experience, their expertise, their cultural background, they can really make a difference in others' lives.
When people start out in psychiatry, is they take the DSM too literally, or they spend all their time learning about the diagnostic criteria without keeping their eye on the whole patient. So there's a tendency to be too narrow and ignore what's really important.
Treat the whole person. Don't get fragmented into only medication or only one disease or all biological or all psychotherapeutic. You want to have a biopsychosocial model so you're treating the whole person.
Treasure the moments you have with your patients. It's a real pleasure and a great privilege to have the chance to work with patients who are suffering with emotional problems and with lots of challenges in their life. And to see this as some opportunity to really help people and to savor those moments.
That in psychiatry you're a physician first, and your obligations to your other physician colleagues is very well manifest in the practice of psychosomatic medicine. These are the most interesting patients, the most interesting clinical problems, and I hope you find that area stimulating throughout your whole career.
Just like the phrase when you get on an airplane and they say, if the oxygen masks fall, put your own mask on before you help someone else. Take care of yourself. Be kind to yourself. That means make sure you get enough sleep, make sure you eat well, make sure you're exercising, make sure you're being as compassionate and kind to yourself in every possible moment as you can. And I promise, if you can take care of yourself, it's going to benefit your patients.
One thought I have for a young psychiatrist is that he or she should keep in mind that our present-day understanding of the mind, of psychic life, is very much influenced by new developments in neurobiology. That our knowledge about the brain constitutes a basic structure that permits the expression in behavior of human motivation. But at the same time, you should keep in mind that the brain activates symbolic structures of the mind, an intersubjective reality that in turn gets organized at a higher level into complex structural entities that determine psychological conflict and interaction with others, and that we have to develop our knowledge at both levels, at basic neurobiology and the study of the symbolic, intersubjective, interpersonal, existential aspects of mental functioning.
Choose a book, a textbook or another one that is more focused in something that's of interest of yours, and just read it cover to cover, the whole thing. Just get a sense of what these authors really were all about and get a knowledge of a subject in some kind of depth. I think you will feel very proud of yourself and you're going to be quite happy doing so. These days we just Google everything and we go to Wikipedia, and even when we look at the books we just skim a little bit, this chapter here, this chapter there. Just get one book and read it cover to cover. All the best.
Be open to learning something that is not that difficult to pick up but requires a little bit of practice. And so I think my key piece of advice to somebody would really be to learn a little bit about the basic idea. It's pretty easy to pick up, but then try to use it. Find opportunities to practice, find opportunities to take advantage of that.
Remember that our patients are our best teachers. You will continue to find through your career, you learn the most through listening and understanding what they have to teach you. And you will become a better psychiatrist because of that.
Find an area that matches well with what you like to do and what you're good at, and continue to stay engaged and involved with your colleagues and peers, because both the satisfaction of doing something well and being part of something bigger is really a way of sustaining happiness and counteracting burnout.
What you really need to do in the primary care setting, you need to be a leader, you need to be an educator, you need to help primary care providers see the value of this. You need to help administrators see the value of integrating primary care and behavioral health, and that it really is the functioning of the team that makes the model successful more than the implementation of the specific component.
Remain faithful to the biopsychosocial model. We have made great advances in neuroscience, but we're embedded in an understanding of the human being as a whole. An increasing interest in personality disorders corresponds to the appreciation that acute symptoms are always embedded in a personality structure, and evidence has shown that to treat only acute symptoms without addressing and appreciating the personality structure is not a full treatment.
I think the best thing about psychiatry is what we don't know rather than what we do know. And that's one of the ways that I got interested, for example, in the study of personality disorders. So pursue what you find the most interesting, and I think you'll have a very rewarding career.
You've learned a lot about what are standards of care, and these are essential practices by which we do our best to take care of our patients and families. What treatment works for which patient at what point in the course of their illness. And I want to say, as much as that's essential, it's probably not enough. And it's not enough because people live in a social and environmental context. There's much more going on, much greater forces that affect their health and their mental health.
Make sure you have your social network for psychiatry, and there is none better than the American Psychiatric Association. American Psychiatric Association, one of the few medical associations that represents not only its practitioners, but also its patients. And many of our patients are disadvantaged. So whether it comes to issues of parity, of benefits, affordable health care for the mentally ill, for those with substance abuse, whether it's for improving reimbursement to cover these individuals, these are the kinds of things that the APA thinks about. It does also the annual meeting and books, such as the books behind me, including my own textbook. But the APA is really your organization and association that you should belong to. It will, in fact, be of great assistance to you in pursuing your dreams and your passions. So join and stay a member of the APA.